It is Indiana in the Morning, presented, as always, by First Commonwealth Bank here on AM 1160 WCCS and 101.1 FM. And Liza Gazda is with us this morning. Good morning.
Good morning.
Aging Services and the APPRISE Program. What is it, and how can folks get involved?
APPRISE is the State Health Insurance Assistance Program, which we do Medicare benefits counseling for Indiana County residents that are on Medicare. And our program, we use volunteers to do counseling.
Does it require extra special training, or should the average person of some qualifications be able to get it pretty quickly?
Most people will be able to get it pretty quickly. There are trainings. There's online modules that they would need to take, and there's also a 3-day new counselor training that's usually held in Youngwood, PA at Westmoreland Community College.
The idea of the APPRISE program, where did it come from? Is it something that Aging Services has been involved in for a while?
Yes, and it is a state program, and we're at Aging Services.
All right, so for folks that are interested and would like to become a part of the program and learn about this and then therefore be able to help families, what must they do?
Well, first off, we're having an enrollment, we're having a volunteer recruitment event on August 9th at 3 o'clock.
Okay.
At Aging Services. So we encourage anybody that might be interested to come to this event.
You need to sign up ahead of time, or can you just show up?
You can call, or you can just show up at 3 o'clock. It runs from 3 to 5.
What's going to happen at that event? They're going to learn about it, obviously.
Yes, they're going to learn about the APPRISE program and all the duties that would be required to be an APPRISE counselor.
The whole idea of Medicare counseling, the whole idea of jumping into something that you're not quite sure what it's all about, can sometimes be intimidating, but it doesn't need to be, does it?
No, it doesn't need to be. I help everybody go over everything, let them know what's going to happen, what they need to expect as being a counselor.
So you're talking about what insurance options are there for people who are on Medicare?
That's what they'll do. When they're counseling beneficiaries, they'll explain all the Medicare programs out there. They also screen for any extra income benefits to help people save money on their medical costs.
Yeah, and it can really be a big savings to folks who get this sort of counseling. Yeah, and people are scared of it.
They are. Medicare is very complex, and when they sit down with a counselor, they'll leave knowing everything they need to know about Medicare.
Historically, how much of an impact has APPRISE had here in Indiana County? Has it affected a lot of people in their lives?
Yes, it has. Just this year, we've helped about 900 people.
Wow!
Just this year, yes.
Wow! And how long has it been operating in Indiana County? A few years, at least.
Yes, a few years, and it wasn't even called APPRISE back then. It was just Medicare benefits counseling.
Wow. Okay, so this event is coming up when?
August 9th.
Okay, that is what, next?
It's
next Wednesday.
Wednesday.
Next Wednesday, and it's at 3 o'clock in the afternoon.
Yes.
And they can call ahead of time, or they can just show up.
Yeah, they can call Aging Services at 724-349-4500, and we're at 1055 Oak Street.
Now, when you meet with people and you counsel them on these issues, is it generally done in the home? Is it done at events, public events, or what's the typical situation where an APPRISE volunteer gets together with somebody to advise them?
Mostly, typically, it would be in the office.
In the office?
In the office.
Okay.
I do home visits. We are at health fairs.
Oh, okay.
Things like that, and I usually give my information out, and they'll call and make an appointment with us for the office.
But It's an easy office to get to, boys and girls, so we don't have to worry about that.
Good parking.
But that being the case, then people who want to learn more about what you do from the other end, not from being a volunteer with APPRISE, but somebody who wants to take advantage of the services of the APPRISE program, what do they need to do?
Just call the office and set up an appointment. Just
as simple as that.
Yes.
For folks who don't know, the Medicare eligibility could be approaching for somebody. Is it an age-based thing?
Yes, Medicare you get when you're 65 years old. Mm-hmm. However, there are people who are younger and disabled who, after 24 months of being on disability, they are entitled to Medicare. Okay, so those certain circumstances could qualify someone earlier than the age of 65. Yes. But for people who are in that 60 to 65 age bracket, and it's approaching in a couple of years, this is something that they probably want to take advantage of, so they understand what's available to them. And I'm sure that government sends them literature, but sometimes, literature comes and just keeps going right on through your hands and into the garbage basket, and we don't want that to happen. Right. People will usually, even 7 months before their 65th birthday, they'll start getting information in the mail. Mm-hmm. And that's usually when they call me up. But I do have people calling saying, oh, I'm going to be 65 in December of 2018, and I really need to come in and see you right away. Mm-hmm. So I will see them, and they'll get some kind of an idea on what they need to do. Now, you mentioned that there are several programs that are available through Medicare. And obviously some programs would apply to some people and others to others. How many programs are we talking about, and how widespread is the whole idea of I'm eligible for this one, not for that one? Talk about that a little bit. A big thing is, and it's through the state of Pennsylvania, funded by the Pennsylvania Lottery, is the PACE-NET program, okay, which helps just with prescriptions. Okay. And there are income guidelines with that. Basically, it's $23,500 for a single person. If you're a married couple, you can make $31,500. Mm-hmm. Some of the other programs, there's one for somebody new to Medicare this year. You're going to pay $134 a month for Medicare Part B. Okay. There's a program that'll pay that for you. Mm-hmm. And I believe you can make $1,300. I don't have the numbers right in front of me. That's okay. Yes, but there's a program, if you think you're eligible for that, if you're low income, definitely call the office. And then for the Medicare Part D, the drug coverage, there's a program that will also pay that. Mm-hmm. That Medicare Part B that you were talking of a couple of moments ago, that's one that you're hearing more and more about on TV, actually, in commercials. And it's getting a lot of play, and people are wondering about what that is. Yes, that's Medicare Part B. That would cover your doctors and durable medical equipment. Mm-hmm. Okay, so those. And then there's a lot of out-of-pocket cost if you just have the original Medicare. So really, we counsel people on anything to go, a supplement or Medicare Advantage plans to go along with your Medicare. Yeah. So coming up next Wednesday will be the event for folks who want to become involved as APPRISE volunteers. About how many people do you have involved right now? Right now I have 4 volunteers. 4 volunteers. Mm-hmm. Is there a target that you'd like to add? I would like to have about 4 more. Okay. At least 4 more. Okay. 4 more would give you a total of 8, and that would lessen the burden on the ones who are working with the program now. Right. Well, Lisa, it sounds like you're doing the hard work, and everybody else is involved in the program. We want to get them there next Wednesday, 3 p.m., Aging Services on Oak Street in Indiana. Yes. Very good. Thank you so much for coming in. We appreciate it. Okay, thanks for having me. Liza Gazda with us from Aging Services, the APPRISE program. Again, that program next Wednesday for the folks, the volunteer recruitment, next Wednesday at Aging Services on Oak Street in Indiana, begins at 3 p.m.